Hi everybody, it's Dr. Berardi and here to answer another question. And it's actually one of the most important questions that I've had, and that is, how does smoking affect my surgery? Nicotine products are very common, and one thing to delineate is smoking is one thing, right? I have plenty of patients say, oh, I quit smoking, but then they start using nicotine gum, a patch, or even vaping. Well, it's not the smoking that causes the problem, it is the actual nicotine, right? So what nicotine does, it vasoconstricts, or it shrinks the diameter of blood vessels. And in relation to surgery, typically the blood vessels that matter are the capillaries. And these are the smallest blood vessels in the body, and our red blood cells actually go single file through these blood vessels to deliver oxygen and nutrients and healing factors to the area of surgery. So if you have a blood vessel that is only big enough for red blood cells to file through single file, and we then have nicotine on board, well, those blood vessels constrict, which means pretend this blood vessel is this big, and the red blood cell is just a little bit smaller than this. We have nicotine products in our system, our blood vessels shrink, and those red blood cells no longer get through the capillaries where what they need to do to deliver their nutrients, their oxygen, and so forth. So smoking is not, well, one, we don't allow it prior to certain procedures, but it adversely affects your surgery, it adversely affects your ability to heal. Some procedures in which smoking is a definite no-no, you have to be nicotine free at least 4 weeks prior. Things like tummy tucks, face lifts, breast reduction. Reason being is this is where we are elevating flaps of skin and altering the blood supply to these flaps of skin. And it's super important because these capillaries are what are feeding these flaps of skin. So nicotine on board, elevate these flaps, leads to what we refer to as skin necrosis, or death of the skin. And you do not want to go through an elective surgery hoping to turn out with a wonderful, beautiful cosmetic outcome, but yet add nicotine and you could have significant wound healing problems. You can have increased risk of infection. So it's a difficult thing to quit. I know nicotine is probably the most addictive substance in the world. However, what a great reason to quit smoking or quit using nicotine products other than having a nice reshaped body, rejuvenated breasts, a nice flat tummy. So nicotine, when it comes to surgery, is a very bad thing to have on board, especially during the procedures that I listed.